during hurricane season? Do I have more than one security incident coordinator, responder, whatever you want to call it? Do I have just one person? Is that good enough? Do they really like their cell phone and want to have it with them all the time? No, they don't. No, make sure you've got some depth. What if I've got an incident that goes over 2 days? How many people make really good decisions after being up for 48 hours? Come on, somebody's got to raise their hand. Okay, we got one person here. Good. Incident coordinator. Thank you. For life. So having those response teams connect with your Hicks or whatever hospital incident process you have. If I'm now talking about taking down my medical records system, you got to be standing up that Hicks because you've got a hospital incident now. Your security incident could be a hospital incident, or a hospital incident could actually identify a security incident. If you have a technical CERT, computer response team, make sure you are in lockstep with them because they can help a lot if you have to take a system down or something like that. So I think it's communication, it's developing a team and thinking way outside of IT, because IT is a piece of it. But really what we're talking about are things that our users, our clinicians are interacting with to help our patients. And it's not saying, oh, well, you know what, we're not going to turn anything off because we need to take care of our patients. Well, that's awkward too. But it's making sure you have that right balance and response. And that's kind of that high-level plan that you're involving the right people. There's a next level down, which is your procedures. So how do I think to your point, how do I respond to a piece of ransomware? How do I respond to very bad clicking choices for a particular user? Do I go take their desktop? Do I unplug it at the network source? So this is just operational procedures that ideally will help you contain a lot more quickly and not have a panic run in circles scenario. So I'm very, I guess, high level here, but there's a lot of pieces to it, and I think that it does take a village. And I think that the one thing that was sort of implied, but after you have an incident, there's a really great learning opportunity there, because and I've done security incident response for more than what I can count on both hands, and I don't think I've been through one where I haven't learned a little something. Can we do something a little better? Can we do something a little different? Do we have a system setting that needs to be adjusted? So take advantage of that as an education opportunity, not as a you did wrong things, but actually, hey, we can learn from this and everybody gets a little bit smarter, a little bit better, recognizing we've just gotten better to fight the previous wars, but maybe we can use that new information going forward. And I overtalked.
So I think some of the takeaways is identifying roles and responsibilities, testing, doing a post-analysis, and make sure that this incident response plan, DR plan is evolving. Communication.
To add to that, the last thing you want is, most IT guys are pretty black and white, right? It's either on or it's off, it's either working or not. You don't want your senior engineer going home telling his or her spouse that, guess what, it happened at work today. You know, the EHR went down and we lost 10,000 records. Because then that person will talk to somebody at their job that says, oh, this happened, and when in fact it could not be that bad, or it could be worse. So having that communication plan is key. Who's going to communicate information to leadership, to to clinicians? How are you going to do that, and in what form you're going to do it? And it can be hard for people to accept that they don't have a choice in the process, that they can't. If I just go unplug that PC, everything will be fine. You know, being an IT engineer for a lot of years, I would go, yeah, unplug it, and we'll worry about the ramifications later. But being able to kind of have that plan and who's going to do what part is huge.
And I think it's good to have, part of your plan, have a contact list and include companies such as like a forensic company. So you're not running around calling other people trying to find the best forensics company. You have that in place so you know who to contact. The next topic is what I feel is the biggest topic, and it is a weakness I see in my healthcare clients, and that's the human element. And employees are the front line of your defense, really. They're the ones that are interacting with patients. These are the employees that are getting emails, as we discussed, which stresses an importance of a robust, comprehensive security awareness training program. So I'd like to ask the panel, what are the methods and what do you see out there to make sure your employees have enough security security awareness to ensure that a breach doesn't happen.
Sure.
All right. So is it, how many people have heard the term picnic? Ralph can. Excellent. And that means problem in share, not in computer. So and it's a help desk term, but I think we're all problems too, because we'll get emails and they look real. I've gotten some emails and I'm like, wow, this is really convincing. Usually it's somebody else saying, hey, I'm not sure about this email, and they send it to me. I'm like, oh, thank you. But it's every day, having that user kind of looking at that and making that right decision. And these emails are good. They're really, they've got spell checker now. Oh my goodness, that is really actually making a lot of problems. They're taking logos from our own organizations and putting them on there, and they're centered. So they're getting smarter, and so we've got to have our users also get smarter. I've also had a user say, I haven't got this email from this organization, it's really time critical. And I said, well, have you been deleting emails? Oh yeah, anything from outside. Okay, so we also don't want to over-educate them or say everything on the internet's bad, everything in email's bad. So it's that whole balance. So from a training perspective, and I don't look at it as training, I look at it as education, it's kind of lifelong learning, because training feels like one and done. And it's really about kind of creating an overall process for them and bring it to where they are. So nurses might need different things than doctors, might do different things than administrators. And IT, and how many people are in IT here? Okay, we are the worst, just so you know. So we have, the standard annual training. We actually blend our privacy and security training at the same time. So we have privacy topics, we have security topics, and they're blended. What we're really doing in a way is showing about, this is about protecting our patients, and security is another way that we do that, another way that we take care of our patients. We take care of our patients' data, and a lot of us are patients in our own facilities, so it kind of helps us too. Also, we do topical throughout the year. So if you see a big news item that everybody's talking about, time to get a little communication about that type of thing, or how users can prevent that type of thing from happening in our organization. So things that hit the news, or things that are topical, or things that are threats or risks, get something out that's a little bit more real time. From an email perspective, not everybody reads email. I don't know if you knew that. Like your nurses, how much time do they have to stop and read email? Maybe not a lot. So be thinking about multimedia. Now I'm not talking about balloons and confetti, but multimedia, like do you have a screensaver that you can put some messaging on? Do you have an alert you can put on your EHR? Do you have, hey, good morning, as they log into their system, quick reminder. So think about kind of being flexible and bringing the message to where they are, but also making it clean, crisp, and if there's a call to action, what that is. We also do some targeted ones. So I think you mentioned phishing. How many people know the term whaling? So not as many hands. So whaling is like fishing for the really big fish. So it's maybe sending a request to, I don't know, like a payroll lead and say, hey, could you just, give me a dump of the W-2s? And if it's, a stranger on the street, and they're not going to respond to that, but if I do the logos just right and the signature just right, could I make that for maybe, I don't know, a CFO? And run it through spell checker? Okay, now we're getting interesting. And do some spoofed email. If some people start to look worried. Do some spoofed email. So those types of things. Maybe you want a targeted message to people in levels that might get more of these. And I think if you ask, some of your leadership has gotten these, and then hopefully have made good choices, but getting some targeted communication out, maybe some examples, making it real, and therefore they get it, that's the message right to them. The other thing is looking at, if you have training for like a new EHR or upgrade, it's okay to sneak a little privacy security goodness right in there. Make that part of the training process, so they're kind of getting reminded in areas where they're used to it and where they know about it. And then if we have certain areas that maybe need a little extra help, or we actually have requests from managers, hey, come and do kind of a talk, give a demo, spend 15 minutes in a team meeting to just have a topical conversation. So I think it's really about that multimedia blended and make sure it's flexible enough. Thank you.
No problem. What time do we have?
Let's leave 5 minutes for some Q&A.
All right, fine, all right, cool. So yeah, security awareness training, that's like, I think probably my favorite part of information security, as nerdy as that sounds. I like it because it's the people side of things. I like dealing with people. And it's fun trying to find ways to connect with people in different ways on this topic because no one's really interested in it. No one wants to hear it because everybody wants to do their own part. I know, right? It's crazy. Imagine that. People have their own job and they want to focus on that. And they don't want to listen to us. So, that being said, one of the primary things is the why. I think that's really key to get across. Like, so, at Maine General, that's like the first slide that I usually put up within our training is why. Try to use a little bit of sometimes scare tactics to get people's attention, give some statistics about how much a medical record is worth on the black market. I know at Maine General, the one that I throw up there is I think it's over, from our email filtering, it's like over 90% of the emails we get from outside Maine General are malicious in some form or fashion, so that kind of gets people's attention. Another key thing for security awareness training program is leadership buy-in. I mean, that's, if you get into information security, that's kind of the key to like absolutely everything is getting senior management buy-in on everything. Nothing could be more true on security awareness training because they're the ones that are going to get you the venues where you can actually reach the people. So there's also, you can do, you know, the compliance piece of it where yes, everybody does their annual training where they look at PowerPoint slides and they pretend to read them and they click through them really fast and then they're done. So that kind of satisfies your compliance piece. There's more to it though, and that's where I like the in-person training. So like Barb was talking about, where if you can, you know, make friends with the directors, the managers, get invited to nurse and staff huddles, get yourself out there so you can actually talk to people and have them ask you questions directly. Same thing with leadership, like we have leadership conferences at Maine General, so getting the opportunity to be up in front of the leadership and teach them. And have different training that's tailored to them. Talk about whaling, talk about spear fishing, talk about what they can teach their employees, you know, train the trainer. Another thing is, like I said, the new employee training. I don't know if I mentioned that or not, I think I might have, but doing that for new employees that come in. We do orientation every Monday, so I am there every Monday, or my analyst is there every Monday to face-to-face talk to the new employees and let them know what the threats are and what we need to be doing about it. Another thing that we're working on implementing is phishing tests. It's kind of the one way you can actually get quantifiable data on your biggest vulnerability in your entire network. And you can provide, it's another way, if you want to get senior leadership buy-in, you can use that. Hey, look, 70% of the people in our organization clicked on these test phishing emails. We probably should do something about that. Another thing, is, this is kind of like a buzzword I think in healthcare currently, is rounding. So I'll actually team up with our privacy officer and we have like a little checklist we'll use. And we will go rounding in different clinical areas. And you know, some of the questions are, you know, looking for unlocked or unlocked computers with PHI left out. Also interacting with them and just asking them, hey, who am I? Do you know who I am? Do you know like what, like, oh, not that I'm important, I'm not saying it like that. I'm saying, hey, you know, do you know who to contact in the event of, you know, an information security incident? Or, you know, what about pretending you're Chris, my, you know, privacy officer, then do you know who she is? Do you know why you're supposed to contact her, or if you are, or anything about that? I mean, it's also kind of fun sometimes to take your badge off and just go behind a nurse's station and start playing with medical records or hop on a computer and see how many people actually call you out. That's realistically, everybody is, as long as you're dressed nice, and as long as I smile at them and say, hey, how's it going, how's your day? No one's going to call me out, they're just going to assume I'm dressed professionally, I'm supposed to be there, I'm supposed to be looking at medical records.
You gotta have a stethoscope though.
Yeah, I mean, yeah, and that's, I mean, everybody thinks they'll do a good job and they're going to be, you know, really brave and they're going to step up, they see somebody that doesn't have a badge and they're going to call them out, but realistically, most people aren't, we aren't. So it's that whole social engineering thing and just testing it. And then also you don't want to embarrass people through security awareness training. You know, with the phishing emails or with the in-person thing, it's not an opportunity to beat people up. It's an opportunity to educate. So use it that way.
I'd add, you know, not just the internal people, but your external. So being obviously at Oxford Networks, we're a vendor of, you know, a fair amount of hospitals. Questioning your vendors, right, on whether or not they're following practices and, you know, preaching the things. You know, they're preaching do all these things, but are companies like ours actually doing it? You know, we're a SOC compliant facility, we're HIPAA compliant, we're PCI compliant, we're always looking at the next compliance. It's really cool to have the letters at the bottom of the brochure, but if those things don't get better every year, and one of the things we try to do is get better every year. You have to meet a minimum requirement to be SOX compliant, right? SOX interesting, you make your own rules. But every year, our auditors say, you know what, take it to the next level. It can't just be, you know, we did it last year, we're doing it this year, so everybody's good. And you know, when Barb comes to see me and says, are you SOX compliant? I say, yes, I am, and she's happy. So questioning not only internal, but external resources. You know, social engineering. I can give you a great example at our data center. We had a customer of ours who sent a third-party company to our data center to try to social engineer their way into the data center. So they didn't say, you know, I'm the CFO, or they said, I need to drop off this hard drive and put it in a server in the back. And the person at the gate, you know, the security gate said, well, I don't have you on the list. I'm going to lose my job. My boss is going to fire me. Half the hospital's down. You're making patient safety issues for me. They went through the whole thing. Luckily, the individual at the security gate said, you're not on the list. If you want me to call Barb, I will confirm from her that it's okay to let you in the facility. I'll walk you. But, you know, making sure that people are questioning, you know, as pointed out, why is this guy sitting behind the desk? And I completely agree. Hey, how you doing today? Good. Are you working on that? Yeah, I'm just checking a couple things for you. I'll be done in like half an hour. Okay. And people will go out about their business because you look like you're supposed to be there. So really making sure that your staff, and not just the IT people, you know that if it doesn't look right, it probably isn't. And it's always good to have a little bit of, you know, skepticism, a little healthy skepticism, and make sure that you're thinking about the things that, you know, if I really let Barb behind this desk because she says she's from IT and she says she's an administrator and she says she just needs me to print out 5,000 patient records with social security numbers on them. Should I really do that? Well, you know, she seems really nice, so maybe I will. And she's like, great, I'll go stand by the printer and wait here, right? So here's a USB drive. Right? Just plug this in and everybody will be happy. So educating your staff is huge, making sure they understand it. And I agree, don't persecute them when they make a mistake, right? There's nothing more that, you know, anybody hates than I'm the one person on the floor, you know, in a clinical floor that clicked on the link and everybody knows it, and, you know, make sure they understand it can happen to the best of us. It's happened to plenty of seasoned, long-term IT guys. It's happened to security guys. It's happened to physicians, to CEOs, CFOs, CIOs. It's happened to everybody, and it's never intentional. So educating them that mistakes can happen, accidents can happen. Sometimes they're out of control, but here's what you need to do. If you think you did something that might not be good, let somebody know. Don't just, you know, I don't think anything's bad there. So that is a huge part, you know, the education of it all.
I also have a social engineering example. So what Wolf does, we do social engineering testing, and I was to do a physical walkthrough and try to get access to a client server room. So I'm in my car, I have a polo on, it says IT support, I'm freaking out. I'm going over what I'm going to say to them. So I walk in, and I have the whole spiel in my head, and they're like, are you here to take pictures of the server room? I'm like, yes. So they open up the server room, like, have at it. And I'm taking selfies.
Are you here to see Barb? Yes, I am here to see Barb. We have important things to discuss. Don't bother us. I'll be in her office looking at her PC. You know.
All right, good stuff. So we have 10 minutes left. And we'd like to save some time for some Q&A to ask the panel. So anyone have any questions at all? Yes?
So my name is Karen Bowling. I'm the CIO at Covenant Health. I'm wondering, with all your security and your training and education of employees, how much you do for identity theft training. And the reason I'm asking is, with all of that, people, when we did some audits, we were very, very good with HIPAA, very good with not clicking on links. But then we implemented a brand new payroll and benefits system. And so we at event actually called folks and said, hi Susie, I'm verifying that your records are correct so that your paycheck comes out correctly. What is your social security number? What is your birthday? What are your children's name and their birthday? All this identity stuff. So are you training identity protection as well as security and HIPAA?
I would say no. Honestly, I mean, yeah, I don't. We've kind of prioritized at this point what topics we want to hit. I think that's definitely a topic worth covering. I think it's probably further down as far as where we're at right now with our security awareness training, further down the road as far as maturity. But no, I think that's like absolutely valuable.
So I think answer for us is yes. We also have to be thinking about the red flag rules as far as patient identity, making sure you don't have insurance fraud and other types of things. So there's kind of that element of identity, but also protecting their own data. So we try to actually make the message for the individual about what they should provide, shouldn't provide, when asked, when somebody calls. Things like the help desk is not going to send you an email asking for your password. I mean, we don't say that that's silly, but things like that. These are things that aren't going to happen. So we try to cover that as well. It's also for them to recognize what constitutes identity. So those patient identifiers, things that make it go from de-identified to identifiable information, and that's that link to privacy. So we cover it in a couple of different ways. Do we cover it in every way possible and all the ways we should? Probably not, because I'll say that universally. I think there's always room for improvement, and we actually adjust our annual training every year because honestly the environment changes so quickly. And then we also look at specific to identity, looking at sort of fraud type trends and then try to target that. And we have some separate training that we do also provide to folks like at registration that may need a little extra guidance on the types of things that they need to be doing to protect our patients.
We try to educate our engineers. We have customer data, right? So phone rings and somebody says, hey, it's sort of the reverse for us, right? I need you to ship me all of my data overnight, FedEx to Mexico, right, or Texas or wherever. So we have very similar rules in the network, telecom, and IT field where it's CPNI and things of that nature, where you just say, you know what, I've got to verify who you are. So the verification part that we train our people on is verify who you're talking to, verify what they're asking you for. Great example. Nobody's going to call you and say, can I get your social security number because you won the Spanish lottery, right? You got $50 million coming to you. That's never going to happen to anybody in this room, and if it does, let me know. I'd like to be there. So
Argentina's okay, right?
Argentina's okay, right? But that's never going to happen. So, we try to, our engineering staff, we try to teach them, and we train them every year, and we go over it. We have audits from external stages out back there. They do all our auditing, and they tell us, listen, here's things that are going on in your environment that you need to worry about, and then we take that and train our staff to pay attention to the little things. Don't get social engineered, right? Don't give away people's data because it sounds like Barb's really nice on the phone, and she must be nice, so I'll take a USB drive and send her files.
Thank you. Don't encrypt them.
Right, and we won't encrypt it yet.
That was a joke too.
Yeah. Encrypt everything.
Yes.
Hi, Ron Russell, formerly the Pop-Up Analytics Lead for Verisk Health. One question I wonder about is, with the virtualization of workforce today, and a lot of the clients I work with are hospital systems, health systems, you have your own analytic teams, BI teams, coders working at home. Everybody wants to collaborate. So where in the ecosystem do you see the Skype, the Slack, Google Docs, people are trying to collaborate? They're all, you don't own them, you don't control them, people are using them. Where does that fit in, and how do you balance that need to collaborate along with keeping the security and privacy in place?
So, how many doctors do you think in a healthcare organization print out patient records at home? Anybody want to take a shot? All day, right? Probably all day, every day. And how many of those physicians do you think inadvertently leave somebody's patient record on their desk where their 8-year-old son can see it, and then go to school and say, I heard your mom, is getting surgery, right? So there's a really fine line between virtual work and allowing people to be collaborative and being safe, right? It can be done. It's really just about making sure you're following the rules, educating the people. So, Dennis and I worked together for years. I don't know how many times we heard about a doctor saying, well, I just put that stuff in Google Docs, right? I can just do that, right? No, you can't, and we're staying up at night sweating that somebody's putting stuff out there. So, finding systems that you can control that provide the type of access and capabilities that people need. Because let's be honest, if a physician can't find a way to share documents with other physicians, they'll go find a way. They're smart people. They'll figure it out. They'll figure out that they can get OneDrive and Google Drive and Google Docs and Box.net and all that. They'll figure it out for you, right? So I think getting ahead of that stuff is important. know, if you have a bunch of people who are working virtually, okay, here's the approved things. You gotta use Skype for inter-office communication. You can't use, you know, is Yahoo Messenger still alive now? You know, I mean, you can't use Yahoo. You have to use Skype, but you gotta make it easy, right? If you don't make it easy, they won't use it, and they'll find something else. So I think that's, for me, that's the biggest thing that I've found is, you know, identifying what they need and then getting them a system to use it that you know is secure, and people will use it.
One more question.
Bridget Stewart, EMHS Security. With regard to IT security and training and awareness, so we have the issue that people will click on links that they shouldn't, but we also, on the other hand, have the issue of people not actually reading their email. So what is the most effective way to reach the masses for training, for awareness? Because email is not always that effective. So I wonder, maybe some ideas that you have, what you might do.
So, and this, I'll go back to the management leadership buy-in, and Ralph could answer this question as well. But for my organization, I worked with HR, and I worked with other folks that are sort of oversee workforce, because we do training that's not just for employees, but workforce in general. We actually require annual training for both privacy and security. We do the slides. We do have a quiz, and you have to score 100%, and as well as an agreement sign-off. If you don't take those steps and do that, then from our perspective, we don't feel the risk is worth for them to have access to our systems. So we actually give them lots and lots of warnings. We warn their manager, but they could actually risk losing systems access. And we're not bluffing. We will remove access if they don't complete the training. And that is for physicians, for nurses, for administrators, and for IT people, so sometimes we're the ones we have to chase. So that's how we do it for the annual training. We can't necessarily confirm that everybody looks at a screensaver or looks at some other thing, but we do that, and in some people, because they don't read email, we make sure we publish this broadly as far as what the process is. And after the first year, the second year compliance and getting it done was really, really good. I mean, everybody followed through very quickly on that because they knew. And that's, again, that's leadership support and buy-in, and we found that to be very successful, and we got a good positive experience with it at the end.
So I think that's time. We'll be around for the rest of the afternoon. If you have any questions, feel free to come up to us, and thank you for the panel members.
So we are at our lunch and networking break here, and a couple of items I think that we want to cover from a execution perspective. We want to make sure A, you eat well, B, you network, and C, we have an eval that I think we're going to be handing out about the event. And this is my plea. We try to put a lot of effort into a good agenda, good curriculum, great speakers. I think we're off to a great start. We want to hear your feedback, so please, please, please fill these out and turn them in. That way we can find out data are, or our thoughts, really welcome in reality. And I think we're doing a raffle. Is that correct?
There is
I'm not sure if it's on. We're doing a raffle, I believe, in some way, shape, or form. We're figuring out the mechanics of it for everyone who turns in an
When you
eval.
turn in the survey at the end of the day and your badge, and if you leave earlier, turn in your survey and the badge, and we're raffling off a New England Himss membership. And you'll be notified later who wins. So if you could fill out the survey, give us your feedback, that'd be great. Lunch is going to be down the hall to the left, all the way down the hall to the left. There's a buffet set up, help yourself, and then bring your plates back here, and then they're gonna come and clear. So that's where it's gonna be today. So if you want to head out there now for lunch, and make sure you do stop by the sponsor tables.
Yes. Joy, we'll start promptly at 12:30.
You too. Okay. And good luck in your selection. Talk to you. Bears.